You're listening to Health is Membership, brought to you by MCAM Architecture and Design. My name's Zach Benedict. I'm an architect working in Northeast Indiana, and I'm sitting down with innovators across the care continuum to examine how we can redefine a culture of health throughout the Midwest. Here we will talk with physicians, economists, urbanists, politicians, poets, and everyone in between to highlight the specific problems facing our communities and consider the most effective ways to ensure their sustainability in the coming years. There are people who complain about being asked to do things outside their normal job description, and then there are people like Paul Miller. Paul is the Division Chief of EMS at Crawfordsville Fire Department, and he doesn't see himself or his team solely responsible for putting out fires. He sees their role as agents of care, responding to the needs of the community wherever they go. And it's that mindset that helped launch one of the most advanced community paramedicine programs in the country, right there in a small community located in central Indiana. It's not every day you get to talk to someone making a difference like Paul's group has, and that's precisely why we invited him to the show. Hi, Paul. Thanks for joining us.
Hi, good morning.
Thank you so much for doing this.
Yeah, thank you very much for inviting me.
So I want to talk a little bit about, nothing big, just how you're changing the world. First off, I guess maybe tell us a little bit about what you're doing and the community that you're working in right now.
So Crawfordsville has been very lucky to be partnering with the Indiana State Department of Health and Franciscan Health since about 2015 to develop non-traditional care methods through community paramedicine, working with firefighter paramedics to really operate at the height of their scope of practice to deliver non-traditional services in the home.
So, Crawfordsville is a town of what, 16,000 plus or minus?
It's a smaller rural community.
Well, what is the normal role of a fire department in a town that size?
So we do everything any traditional fire department does, code enforcement, community education. Obviously, we fight fires and we provide ambulance service, 911 ambulance service to our community.
But how has the change in healthcare and maybe population health in the community changed what you guys do on a day-to-day basis?
So when the mayor appointed me to my role, I had done some reading early on, and I read a white paper from Harvard University talking about shared value and changing expectations of care and really trying to bridge public-private partnerships. And my role in EMS was to think outside of the box and delivering a different program. We were seeing a high number of falls in our community. Almost about a quarter of our call volume is directly related to senior citizens having a fall in the home. So we were trying to develop a program to help our seniors age in place. And since that time, we've seen about 125 rural health hospitals close across the country. And that's one of our major employers in the community. And it also creates more health disparities. If anyone from my community needs to travel an hour to see a primary care physician, a pediatrician, a specialty care physician, it's going to create more 911 calls essentially for the fire department. So we were trying to think outside of the box and create a preventative program that would be meaningful and impactful to not only the community, the department, but the hospital as well.
So how has that program evolved over the last few years?
So over the last few years, it's evolved from fall prevention to chronic disease management, doing a 30-day readmission avoidance program, focusing on heart failure patients, diabetics, anyone with pneumonia or sepsis, and COPD. We've also initiated the first of its kind in the country, a high-risk OB program, protecting our most vulnerable women during pregnancy. We have initiated a quick response team utilizing our firefighter paramedics to deliver medication-assisted treatment for people with addictions in the home. And most recently, COVID vaccination, now all immunization program in our schools. So really cradle to grave, looking at protecting our whole community. And it's very patient-centered. It's delivered in the home. So it's really had a huge impact locally.
Is this done in partnership with a local healthcare system or multiple?
Yeah, so we're fully integrated now into our health system with Franciscan Health. We would have been unable to do this without their oversight and partnership. We want to make sure we're not duplicating services, but we're really getting the people to the right care at the right time at the right cost.
Was there a challenge in how those two entities were integrated?
For us, no. So in 2012, the hospital was starting a new program with CMS. It was a Pioneer ACO, and the Accountable Care Organization really looks at population health and the social determinants of health. So 80% of someone's health outcomes can be directly attributed to someone's social determinants, whether it's food insecurities, housing insecurities. So with them being a Pioneer ACO, creating new leadership in that role, having a new CEO of our hospital, and then me being new into my role, we were able to really form just a fantastic partnership and really had very little hurdles. We were all on the same page.
I assume you then have integrated EMR?
Yeah, so my community paramedics document in Epic. So it's seen by not only the nurses, the primary care physicians, but specialty care as well, all throughout the health system.
Was that a challenge, or usually that's what we hear is one of the biggest hurdles, is that integration?
It took a little bit of time to develop. So the hospital didn't have this set up. We were having to document under the ACO nurses for a few years until that Epic could be constructed. Initially, cost was going to be a challenge of building this for our paramedics to be able to document in this space. Once it got going, it was a lot lower of a cost issue than we first anticipated.
How much of your time do you think is actually dedicated to putting out fires? You get this question all the time, don't you?
Yeah, so recently it's been up a little bit, but typically, it's probably less than 10% of what we do is fighting fires. Now, when you start to put in alarms and different rescue calls that we go on, it goes up, but EMS is just, one of those things that it's what we do well at the fire department. We've evolved over the years from just traditional firefighting. Our fire prevention has just done an amazing job over the last 40, 50 years, and our runs have gone down. Serious fires have gone down, but the need is still there and exists.
In some ways, is it fair to classify you as an in-home care group that puts out fires?
No.
What are you then?
We're emergency responders.
So what does that mean in terms of?
We're an all-hazard department. So when somebody doesn't know what to do, it's an emergency on their part, and we're able to work through it. Whether it's a structure fire, a car accident, or somebody that has no significant others and they have a fall in the home, that's an emergency. And if we can prevent any of those falls in the home to help our seniors age in place, to avoid a hip fracture, a surgical stay. Yep. Traditionally, if somebody in their 70s has a hip fracture, it's going to be very hard for them to transition home. And their mortality rate really goes up significantly.
How much of your time then is dedicated to reacting to emergencies versus preventative strategies?
So we separate our divisions here at the fire department. We have code enforcement that deals with all fire prevention. We have our 911 side that deals with fires and EMS, and then community paramedicine is a separate division.
Okay.
Is that
we silo it so our community paramedics that work in each one of these spaces work directly with primary care or specialty care in that space. It just forms a better relationship. Education is better, oversight is easier. So we're delivering a better level of care through that direct relationship with the physicians.
Has how you train or incentivize staff on that paramedicine side changed over the last 5-10 years?
No, so we really didn't have, we had a blank canvas to start with. No one else in the country has really been doing community paramedicine that we have. We were the first fire department in the country to be fully integrated into our health system, documenting in Epic. So we've really been able to create this from nothing.
So where do you
We've
start?
had other, what's that?
So then where did you start? How do you know, where did you go for a resource?
I mean, there were other places doing it. So we were trying to make those relationships happen. So Hennepin College in Minnesota had already started this program. It's a siloed health system, but they were already working with Medicaid reimbursements. We had reached out to them. We had sent our paramedics there to Hennepin College for some initial education. The University of Cincinnati was very gracious, and they were beginning a community paramedicine track as well. They had invited us to speak as we were evolving and developing this. And through those relationships and seeing other communities grow theirs, we had a huge opportunity. Representative Tim Brown, who lives in our community and moonlighted in the ER, we had a fantastic relationship. And I think around 2010, he licensed paramedics in Indiana, or at least authored the legislation to get that in place. That was a huge opportunity for us because we're no longer certified. We have an unlimited scope of practice as firefighter paramedics in Indiana that allows us to do a little bit more than other states working under the direct oversight of a physician. So we work as physician extenders in Indiana, and we're able to do this because of our fully integrated care plans.
Tell me a little bit about Project Swaddle.
Yeah, that's one everyone wants to know about.
Yeah.
Everyone loves babies. So Project Swaddle actually evolved out of us trying. We were very, very successful early on in receiving grants. This was a new thing, created a lot of interest, and we thought we would be very helpful in assisting our Women's Resource Center in attracting the nurse family partnership to our area that had no immediate thoughts of investing in our community. We were very unsuccessful in helping them get that grant, which we thought was going to be a slam dunk with our hospital. And the more we were meeting with our nurses, our OB physicians, and the Women's Resource Center, we identified that we could do this as well. Very non-traditional, having a firefighter paramedic go receive any kind of lactation education, Lamaze education, and definitely drew a lot of attention walking into those early certification classes, but it really created quite a buzz, and it's almost has its own cult following in Crawfordsville. People want Project Swaddle, and Project Swaddle delivers care to expecting women anywhere from inception up to 16 weeks postpartum. We receive referrals into our program of high-risk moms anywhere from first, second, or third trimester up into a week postpartum. So it was really a huge initiative for not only our community, who does not have a birthing center, but of doctor boxes as well.
How much what you think you guys are doing on a day-to-day basis is something you would argue more, if not all, fire departments should be considering?
I think every every fire department should do this. It creates career longevity too for our firefighter paramedics. We're able to capitalize on careers of experience. And it has a huge return on investment for each one of our providers. Their job satisfaction after transitioning to these roles have gone through the roof. They just feel more involved and more impactful in the community. They can see the direct results of the care they're providing. Professional inclusion is huge when they're respected. My Project Swaddle paramedic can walk up to the delivery center and they will round him the same as a physician. It's just, yeah, it's a fantastic feeling. I'm stopped at the grocery stores and told either by senior citizens or women who have delivered about the care they received. It's very, very rewarding. And it should be the expectation of care of every community. This is what we do. We help people on their worst days. And going and having to stay in the hospital and provide care post hospitalization for any significant other, or if you're by yourself, is extremely difficult. It's taxing mentally, and we can do a better job. We should be known for our customer service and ability to deliver very high levels of care. So I just think it's what we're supposed to do. It's just a different role.
What do you think stopping other communities from replicating what you're trying to do there in Crawfordsville?
So the biggest challenge right now is financial sustainability.
Mm-hmm.
We do this 100% free because of our partnerships with the State Department of Health and Franciscan Health. And it's really used differently in our community because we're wanting to use this to attract professional people to our community. We're wanting to use this to attract business and industry and better support our existing business and industry offering non-traditional services like this. It's really putting full wraparound services in place to make our whole community more successful together. I think next year is a budget year. We've been a part of two pieces of legislation that have passed to allow us to provide community paramedic services outside of a 911 call and establish the reimbursement. Now, next year would be the reimbursement rate and what that looks like, whether it's bundled service through a physician's office or it's direct payment to a fire department. I think once they see that pathway, one of the things that makes us, I think, a better partner as a fire department and a government agency is our clerk treasurer's office.
How so?
Well, I mean, if you think about it, we have to operate with full transparency. Everything goes, to the state for oversight. So anyone can walk into my clerk's office and see what it costs for us to deliver services and care in this space. We're completely siloed. This is a separate entity as far as budgeting goes in the city. So we don't need to make money. We don't want to make money. We want to provide this level of service. So for a health system to be able to partner with a government agency and see that with full transparency, the State Board of Accounts audits each one of our interactions. So it's safer for private and public partnerships to happen. And that's what's of interest, I think, to Indiana Medicaid or any payer source that's going to be interested in evolving community paramedicine for reimbursement.
What role do you think the future of paramedicine has on the economy of rural communities?
Well, like I said, if 125 rural health systems have already closed and shifted care and created more health disparities, I think that's an amazing impact right there. $750 billion goes directly to inefficient and duplicated health services, and only 1% of that or less goes to EMS. So if we really change that, you think of how all those billions of dollars could be reinvested.
Is that a state or a federal problem to solve?
Federal. I think it's a federal problem.
Yeah.
So we can do it on a state level through Medicaid, but when we talk about Project Swaddle, people would assume or have a stigma attached to Medicaid moms being most at risk. And 70% of the women enrolled in our program with Project Swaddle specifically have been of commercial insurers.
Hmm.
So it's not just a social issue, it's a healthcare challenge and a healthcare issue. If a woman needs to be on bed rest, they don't care if you're Medicaid or commercially insured, but you're not able to work. If you have to go to a NICU, that's about $175,000 a week. That mom is not going to be back to work immediately. It really creates a ripple effect all throughout our economy. And I think fire departments can really be very impactful in meeting these challenges. It's just staying within our lanes. So I don't have a background in healthcare administration, business administration. I am just a firefighter, but I align with Purdue University, IU. I've worked with Manchester University. So it's putting subject matter experts in each one of those areas to help lead and guide us. And they've done a fantastic job of helping mentor me and where my lane is and how we can be most impactful to our community.
You get a lot of attention, rightfully so, for Project Swaddle. Like you said,
Everyone loves babies.
I get it. On the other end of the extreme, though, I think a lot of your work is likely probably dealing with a rapidly aging population.
Yeah, so that's definitely challenging. It's amazing to me how many people don't qualify for home health. And there is nursing shortages, the same as firefighter paramedic shortages. We can collaborate. So our referrals come through our accountable care organization. They have a nurse in each office that identify patients, senior citizens that have been recently admitted or at risk of an admission. And we can go in and deliver those services. Once we're in the home, since we're fully integrated, we've trained with home health and hospice to identify how patients are referred into their program. We've referred patients after our first visit in the home to hospice and home health. And home health has referred back to us. When we first started, I think after our first 6 months and people were more aware of what we were doing, about 90% of our referrals actually came from home health.
And is that in all of these cases, it feels like success is measured in some way by the partnerships you have with local entities and institutions within the community.
It's really a community program. So when we look at the cradle to grave approach and really creating patient-centered care and a more holistic way of caring for a patient in the home, looking at the whole environment and the social determinants. And 80%, like I said, of social determinants affect someone's health. We partner with the drug courts, the jails, family court, veterans court, probation, Department of Child Services, the Women's Resource Center. It's the whole community that helps guide this project, including faith-based services as well.
Sure. Did you, one way to ask this question, which I'm not, is which partnerships were the most troublesome to get over the finish line? But a different way to ask that might be, do you think the reception you got from these partnerships when you first said, this is what we're going to try to do, was positive because it was coming from the fire department, or because it was a community that already had individual relationships, reputations, and personalities that, that kind of speed to trust model where it really had nothing to do with the institution as much as you knew who the individual was in charge? So
working in a smaller rural community, we already have those relationships. But I think it's easier for a fire department to capitalize on those relationships. You're already a trusted member of the community. It's definitely easier for us than a private business to start this, but very early on, the community foundation invested in us. And from that investment, that was more instant credibility to really drive this program throughout the whole community. initially my mayor said, we can't financially grow this out of nothing. If you're able to evolve this and get this going, we're going to support it. But we just can't give you money to create this program that we don't even know works.
Right.
Community foundation was huge. Well, and our hospital CEO said the same thing. But when we went in and met, they were already in the process of doing their health needs assessment. So the director that was running that at the time, we had the opportunity to sit down and meet with. They scrapped their previous project. I'm not sure. I think it was something with diabetes education or something like that. They scrapped it and invested in us at the fire department, and been continuing that partnership ever since 2015. It's been amazing.
What in your mind right now is the biggest challenge you're trying to think through locally?
It's still the financial sustainability, working with Medicare and Medicaid. Commercial insurance, we've been very lucky. Nationally, I've met with representatives and on many occasions from United Healthcare and Anthem. Multiple meetings, whether it's been here locally in town. United Healthcare did a fantastic video for us. They've invested hundreds of thousands of dollars in order to replicate Project Swaddle in Indiana, a state that they don't even have the contract with. We've been the only department I'm aware of that had every national medical director for Anthem in Indianapolis to meet with us.
Really?
Yeah. So they said it had never happened any other time with any other program. So it's fantastic. I think we have a lot of opportunity.
And that speaks volume to, I think, the innovation behind what you're doing. But I think some of these communities can't wait 15 to 20 years to start a program like what you're providing. What do you think, and I know you can't solve this problem at the federal level yourself, but what do you think are the most, what do you think are the most critical things that need to happen or things that need to fall in place in the immediate future?
So I think they're happening. Secretary Sullivan, prior to leaving office, did a fantastic job of looking at other states, meeting with other health secretaries and guiding this conversation. Locally, we had Jerome Adams leading a lot of these conversations, understood this as a Surgeon General, and we were being involved in some of these conversations at the time COVID hit. And most recently, in the last month, I have had so many people reach out to me to re-engage with the conversations that we were having 2 years ago to make sure that this is funded. I believe Seema Verma from Health and Human Services on the federal level was looking at this, and they'd started emergency transport, treatment, and triage, and building pilot programs with that all throughout the country. So these conversations are still happening. They're moving forward, and cost is going to be a big motivating factor. I really think people are all in these positions to do what's right, but when you can show huge financial impacts as well, that doesn't hurt you to do the right thing a little bit quicker.
Did COVID change how you were thinking through kind of your role?
COVID crippled us. When that first hit, it almost shut down the program. The hospitals were seeing patients differently, which really affected us. We work so closely and aligned with the hospital. They were having us not deliver services in the home. It was purely 911. So the health challenges that came out of that really had long-lasting effects that we're still feeling today.
Sure. If you had to do it over again, is there a different way you would have approached that, or do you think it was just the reality of a pandemic like that?
We will never shut down services again. That's the biggest thing I saw. Our patients, our families, our community needed us. We can't ever stop our care and only be responsive to 911 calls. The biggest thing I learned is we have to be more impactful preventatively. We have to get ahead of all these healthcare challenges early on. I mean, you're not going to be able to save the world. I felt, more ambitious maybe 10 years ago that we were going to solve all the health challenges and financial challenges in healthcare. But people are non-compliant. People are set in their ways. So we use motivational interviewing to really empower our patients to see, where do they want their quality of life to be? What would make them most happy? And then we try to help them achieve it. We don't go in and tell them that they need to stop eating fatty foods, stop eating salts if they have heart failure, stop smoking, stop drinking. We just ask them, would you like to be able to walk to the mailbox on your own without getting out of breath? If that's where your, quality of life stems from, you want to make it to more kids, grandkids sporting events, we work with them directly to help them be successful in achieving their goals, not ours.
Does a community like Crawfordsville understand how different and unique this is, or has it now become part of the culture where it's kind of just, this is what we do?
So one of the proudest things that we've had happen recently to the fire department is Saturday night, the Hoosier Heartland State Bank donated $5,000 to the community paramedicine program to make sure that we're able to offer these services. And they continually do things like that in this community. We are really blessed because it's a small community. It's not hard to get into the newspaper. And when we've been on the NBC nightly news, you have United Healthcare doing stuff. The State Museum had done a whole exhibit on our program. I mean, there's quite a buzz. The mayor helps promote this. And, we make sure that any community event, we're there. Kiwanis, Rotary, we go and speak. We give them updates on each one of the initiatives, or if we start a new initiative, we have a new partnership. We're on about every board there is, if it's dealing with healthcare. So it is the expectation that every Crawfordsville citizen will get this. If I go to the church and speak at any of the luncheons, I have like a stack of referrals that, they just feel their neighbor would really like to have a firefighter stop by and visit with them.
Has it changed recruitment?
I
mean, as more people want to be part of this?
Recruitment is still a challenge. So last year, I think we only certified maybe 300 to 400 paramedics in the state. So paramedics are in high demand.
Right.
COVID has shut down many classes, put everyone a year behind. It's very expensive to offer paramedic training. So a lot of hospitals are getting out of the education business. We haven't seen, I actually probably would have more applications for a community paramedic than I would a firefighter paramedic when I post it. And we get probably more applications nationally. I mean, this past year, if COVID had not happened, we were set to speak in Milan, Italy, and in Sydney, Australia, with Purdue University. Previous to that, it was New Zealand. I mean, we can pretty much go anywhere and be met with open arms with wanting to share it. My mayor really embraces it. He supports this so much that he'll either travel with me to meet with other mayors or elected officials. He's testified with me at the State House, and he gives me carte blanche treatment to go and visit with any community and any conference to share what we're doing.
To your knowledge, has anybody tried to replicate what you're doing?
Yeah, so we're working, we are working with the Rural Health Association right now to replicate Project Swaddle specifically in Indiana. Okay. So Good Samaritan Hospital, it was Margaret Mary. They had an administration change. We're working with Michigan City. Franciscan, Michigan City. So we're working with other communities. I just got a call from Sylvania Township over near Toledo, Ohio, looking for some assistance and guidance. We've met with Mercy Health in Cincinnati, trying to get this up and going. So it's really everywhere. The Tennessee Hospital Association, the American Hospital Association, everyone is trying to figure out that secret sauce, and it's really collaboration.
Right. And that was my question about, just the social and political capital I think you probably need to pull this off. It's not just a matter of solving the problem of funding, which is a huge issue, but it feels like it probably is just as equally challenging if you didn't have the right partnerships and political will to get this done and commit that it's important.
So when we go and speak, we make sure we know who our audience is and who we're speaking to. So while the presentation may be structured the same, you have to speak to elected officials differently so they understand their return on investment. It's not always financial. Fire departments have a different return on investment. Healthcare administrators are different than healthcare CEOs. And just knowing how they can be benefited from these strategic partnerships and what their return looks like, more than likely they already understand it, but it's hearing it and seeing how they could capitalize on a partnership like this. It's easy to market, but it's easy to see a cost impact as well. So
Sure.
If you're a mayor, and we recently attracted Sealy Posturepedic to this community with their world headquarters, that's jobs, that's tax base. That has an immediate return. And for people moving to the community, they're seeing this as a benefit. It would be fantastic if they thought as a CEO that their parents could move here and be safe and secure, aging in place in a community that has firefighters protecting them. Their wives with a high-risk pregnancy have a firefighter delivering this level of service. A CEO is able to see the return through, incentivized payments, practice transformation, which is huge. Currently, recruiting physicians is very, very difficult.
Yeah.
And I think by 2032, there's a huge physician shortage coming. So these kind of partnerships are going to be very important to a CEO looking at expanding the four walls of their hospital.
What do you have on the horizon? What's the next big push or focus?
I don't know that there is. Really, the sustainability, moving past anecdotal stories. So that's where I really like our partnerships with Purdue University and IU. It's really being able to allow people to do an IRB, that institutional review board that will quantify and qualify our metrics and measures and demonstrate success outside of, me saying, hey,
Right.
we're doing a good job. I think it's those professional leaders selling and sending that message out. And if we fall short, being really transparent, because we don't want to go down the wrong path.
Right.
So we've worked through the Clinical and Translational Sciences Institute with both of those universities on separate projects to demonstrate that qualitative success. Now it's moving with our Health and Human Services partner right now, showing a return on investment financially. So working with medication-assisted treatments in our addictions program in the home, if somebody goes to the ER for an overdose, you're getting an ambulance bill, which is the most expensive taxi service potentially, to an inappropriate resource sometimes that's not really geared at treating an addiction issue in the ER, costly medical bills, imaging bills, and stuff like that. What we're doing is we medically clear them in the field through a protocol, and then we can transport them right to an inpatient facility. Those inpatient facilities, though, are pretty expensive. So while we're alleviating an ER charge and an ambulance charge, it's still anywhere from $10,000 to $15,000 a week for an admission to one of those facilities, which is very difficult if you're you as a professional, if I offered you a 10-day stay in a luxurious resort, but you have to leave immediately without saying bye to anybody, it's going to be difficult. And you're going to have some questions answered when you get back. But if we're able to deliver that care in the home with resources that you're familiar with, and we're able to do that psychosocial assessment, really looking at the whole patient and the home environment to see which resources are going to be needed to affect your long-term recovery, that's zero cost. So that's that more holistic care, looking at the big picture and centering that care. And our firefighter paramedics are good investigators. I mean, they've been in the field for 20 to 30 years. They know what resources are around us. And it's very stigmatizing. And that's one of the things that we think we've been impactful with, is reducing the stigma in the community and putting resources in place immediately during that crisis to help someone through their journey of recovery.
Yeah, I think it's a testament to your team that, the community has responded so well to that, and a service that I think, because of the reputation of the fire department, doesn't come with that stigma.
Yeah, I mean, we're definitely hoping that, that we're able to capitalize on that the most, that they can trust us. They know us, their kids go to school with us.
Right.
We see them everywhere. So that level of accountability is higher.
Yeah. Well, we do work all over the Midwest, helping rural communities, and I can't think of another group that's doing more meaningful things than your team. So
appreciate that.
I thank you for everything you're doing. Thank you for sharing your story, and I hope people are watching, because I think what you're doing is really powerful.